to your community focus. October is Breast Cancer Awareness Month, and Dr. Jennifer Goss is the director of the Breast Health Center at Care New England Health Systems. She joins us today. Thanks so much for being here.
Oh, it's a privilege. Thank you.
So let's start here. What does the current world of breast cancer treatment and prevention look like?
Well, let's start with breast cancer treatment. And the really huge advance we've made in breast cancer treatment is being able to identify which breast cancers are lower risk for late recurrence and tailoring back what percentage of women need chemotherapy to achieve cure. So a very established test is the genomic score of the most common breast cancer subtype, and that test has allowed us to take chemotherapy out of the comprehensive treatment plan for an overwhelming majority of women. Wow. If you think back to about 2001, a breast cancer diagnosis almost always incorporated chemotherapy, and now we've been able to scale that back. Breast cancer early detection, which isn't quite prevention, and I always have to remind patients of that. We go for our annual mammograms not to prevent breast cancer, but to find it early. And over the last decade in Rhode Island, we've really seen the impact of that 3D tomosynthesis mammogram, letting the radiologist find cancers that are closer to 8 and 9 millimeters, about a third of an inch, rather than the very common size during digital mammography 15 years ago, which was on average 15 to 18 millimeters. So we've almost seen a reduction by 50% in the size of cancer. And of course, when we find cancer earlier, not only is it smaller, but it tends to be more favorable subtype, lower grade, less aggressive, and so that can lead to, again, more tailored therapy and less toxic therapy.
Some good reasons to try and find cancer early. So what's your pitch to women to make sure that they're getting the consistent screenings that they should be getting, and how often should they be getting those mammograms?
Those are such good questions because there are some different opinions on guidelines about how often we'll do mammography, but we are pretty rigid in staying with annual mammograms for average risk women beginning at the age of 40. There is some research suggesting that maybe going every other year might not be how long you live, a mortality risk. But as we just talked about, the smaller cancer is when we find it and the lower grade it is allows us to do more tailored therapy. So I pitch to women that an annual mammogram is the best way to be sure that you find cancer early and you'll need the least toxic treatment regimen.
Some really important information. Dr. Jennifer Goss, thanks so much for being here.